Are there therapies for improving auditory processing skills? Have you ever wondered if there are ways to enhance auditory processing skills? The good news is that there are indeed therapies designed to help individuals improve their ability to interpret and make sense of sounds, including speech. Auditory processing disorder, or APD, can affect how people perceive and understand sounds, even when their hearing is normal. To address these challenges, targeted therapeutic approaches are often used by trained professionals like audiologists and speech-language pathologists. One common method is auditory training programs. These programs involve structured listening exercises that focus on enhancing specific auditory skills. This can include sound localization, auditory discrimination, auditory memory, and auditory attention. Exercises may require individuals to identify sounds, follow complex auditory directions, or distinguish speech from background noise. These training sessions can be computerized or guided by clinicians and are tailored to meet individual needs. Another effective approach is speech-language therapy. Speech-language pathologists work with individuals to improve their language processing and auditory comprehension. They use activities that integrate listening and language skills, helping to address difficulties in auditory memory, sequencing, and processing speed. For some individuals, assistive listening devices can make a significant difference. Devices like hearing aids or cochlear implants can enhance the quality of auditory input, which in turn supports better auditory processing. These devices are often used alongside auditory training to maximize the benefits. Environmental modifications and compensatory strategies also play a crucial role. Therapists often recommend ways to reduce auditory distractions and improve listening environments. This can include minimizing background noise or using visual cues to aid understanding. Teaching compensatory techniques helps individuals manage auditory processing challenges in their daily lives. It is also important to recognize that auditory processing difficulties can co-occur with attention deficits or language disorders. Therefore, a multidisciplinary approach is often beneficial. This means that therapy may involve collaboration among audiologists, speech therapists, educators, and psychologists to comprehensively address all contributing factors. While many auditory training programs show promise, the degree of improvement can vary. Current scientific consensus supports these therapies as valuable components of a comprehensive management plan. However, it is essential to have individualized assessments and interventions tailored to each person's unique needs. In summary, there are various therapies available to improve auditory processing skills. These include auditory training exercises, speech-language therapy, assistive devices, and environmental modifications. These interventions aim to enhance the brain's ability to process sounds effectively, ultimately improving communication and quality of life. If you or someone you know is experiencing auditory processing difficulties, it is crucial to seek evaluation and guidance from qualified healthcare professionals to develop a personalized therapy plan that aligns with current medical standards.